pledging is one aspect of it, but exactly, I mean, how does it happen? Is our infrastructure ready? What would your wish list for the government be?
I think the biggest help that we need from government is, for example, there are states in the country that you still can't do heart transplants, right? So we'd love to be able to do heart transplants all over India. You can't do them. That's number one. So I think that from a government perspective, in terms of any restrictions that might exist, let's enable healthcare organizations that are qualified, competent, have the infrastructure resources. Let's enable them to be able to do that. That's number one. I think the biggest help that we need is infrastructure. The challenge is that in the case of a heart transplant, when you remove the heart, you have a very limited window to be able to get that heart from person A to person B. And it's not a 12-hour window, it's not a 24-hour window, it's a 3, 4, 5-hour window. And today what happens is we create green channels. We've all heard about the fact that a heart moved from Gurgaon to Delhi, or a heart moved from Andheri to Navi Bombay. That's good. Green channels are good. What we need, though, is a better infrastructure. We need, I think, the awareness level. Unfortunately, that all of us are immune to the sound of an ambulance behind us when we're driving. And instead of getting out of the way, very often you actually see people blocking ambulances. And I think raising that awareness and helping people understand that when you see an ambulance, it's about somebody's life. And let's get out of the way and let's do the right thing. So I think from an infrastructure perspective, whether it's creating special lanes, whether it's about creating any sort of vehicle, we've talked about having drones move organs as well. One of the biggest areas that we need help in is being able to move body organs from location A to location B in time, so that they can get to the person in time.
And earlier you were talking about the epidemic of dengue and chikungunya, which was really bad this year. How do you plan to deal with such a thing? I mean, if next year, God forbid, the same kind of situation. I mean, this year we saw hospitals overflowing with patients, simply not having the space or the beds. So how do you plan to tackle this at Fortis?
See, unfortunately, in the hospital space, we're really left in a reactive mode. There's very little that we can do. So we can educate. Certainly, we can educate people. We can talk about people being careful about how you should dress, how you should be, avoid areas, water, still water areas, etc. The reality is that apart from that, then it comes to education. Then it comes to not just educating our own employees, but our nurses, our doctors, in terms of how do you handle. I think very often that dengue has become it's become a dirty word in this country, that if you have dengue, it's almost like you have to get admitted. The reality is that's not always the case. I also think that we need the help of the media. I think that sometimes there's so much hype around it. And the reality is that I have to tell you, whether it's, and I'm speaking for Fortis, but I would say any hospital. I think that every hospital in this country, certainly I believe for Fortis, I know that to be true, but I think if any other hospital, whether it's Apollo, Max, Medanta, Manipal, and any hospital, I think everybody tries to do the right thing. We're all trying to heal. There is not a hospital in this country of any brand that wants to turn a patient away. We all want to do the right thing. I think we can create, and because there are lots of good stories that come out as well. And so I think that we need the government's help. I mean, and the problem is, the worst thing about dengue today actually is that we talk about dengue when it's here. We need to start having the conversations in June, July, in May, and start thinking, what are we going to do? How are we going to prevent it this year? So I think there's an infrastructure issue that the government has to support us on. I think that Fortis, like any other organization, I think we put our best foot forward. We can certainly do a better job again around building awareness and helping people to know what things to avoid, so that hopefully they don't get it as well.